sort of orient everyone as to how the setup works on WebEx. I hope you can all see that on the right-hand panel you have the participant list and the chat box. So all of the attendees today will be able to communicate with us via chat box. So if you have any questions or comments, please feel free to type them into the chat box there, and we'll be able to help you or facilitate in any way. If you need your screen to be bigger, at the bottom left-hand side of the screen, you can increase the size of the page. So again, for this webinar, just because we do anticipate having many people on the line, what we're doing is we're only allowing our panelists the ability to speak and communicate with all of you via the microphone system. And we ask again that if you have any questions or comments at any time throughout this webinar, that you please type them in the chat box, and you please make sure that you're sending your comments to all participants, just so that if it's a question, everyone has the ability to see the question you're asking. So again, we would really appreciate that. So just before we begin, during the registration process for this webinar, we had asked all of you to provide us some information on what your interest area was in these two CBPHC awards. So just to give everyone an idea of what the breakdown is of the attendance today, we had about 31% in favor of the applied public health chairs, and about 69% of interest leaning towards the new Investigator Award. And then further, we had asked everyone to self-identify by CIHR research pillar. So as you can see in this pie chart, it's actually very encouraging to see that we do have representation from biomedical, clinical, health system services, and social, cultural, environmental, and pop health pillars, which is excellent to see. So with that said, just coming up to the agenda for today's session. So the first area that we'll cover will be the what is CBPHC, and just discussing the relevant research areas. And then for both the new Investigator Salary Award and the Applied Public Health Chairs, we'll go into a description of what each award is, what the available funds are, the eligibility criteria. We'll speak a little bit to the review process and the timelines that you should be looking to adhere to in order to successfully submit your application. And then followed by all of this, we'll be going into hopefully a lively Q&A session, followed by a short poll where we'll be very happy to collect some of your feedback on the session. So with that said, I would very happily like to turn over things to Megan McMahon, who will start us off. So Meg, I will just pass you the presenter ball so that you can take control.
Great, thanks so much, Hawa. So by way of a bit of background information, the funding opportunities that are the focus of this particular webinar are launched as a component of CIHR's signature initiative in community-based primary health care, which is designed to support highly innovative approaches to improving the delivery of high-quality community-based primary health care to Canadians. This initiative is co-led by CIHR's Institute of Health Services and Policy Research and Institute of Population Public Health, and made possible with the support of a number of partners from across the country and internationally. So before diving into the funding opportunities themselves, let's start with a definition of what we mean by community-based primary health care, because I think as many people on this line know, there are a number of definitions, so good to get on common ground. So when we refer to community-based primary health care, what we mean are the broad range of primary prevention, including public health and primary health care services that are provided by a range of diverse healthcare providers in a range of community settings, including homes, healthcare clinics, public health units, hospices and workplaces, and more. Community-based primary health care includes health promotion and disease prevention, the diagnosis, treatment, and management of chronic and episodic illness, rehabilitation support, end-of-life care, and care coordination across the continuum of community-based primary health care. It's delivered in a way that's patient and population-centered and is responsive to the economic, social, cultural, and gender differences. So that's really what we mean by community-based primary health care within the context of these two funding opportunities. As I said, the priority announcement on the new Investigator Award and on the Applied Public Health Chairs Award are components of a broader signature initiative in community-based primary health care, which really centers on supporting research that will transform healthcare for the next generation by improving the delivery of appropriate and high-quality community-based primary health care to Canadians. There are 4 key strategic goals of this initiative, and they really center on supporting the development and comparison of new models of community-based primary health care within Canada and internationally, building capacity by supporting interdisciplinary collaborations of researchers, decision makers, health professionals, and trainees in Canada and other countries. And so this is really where the new Investigator and Applied Public Health Chair Awards come into play. We'd also like to catalyze effective knowledge translation approaches that improve the delivery of community-based primary health care and foster the collaboration of the community-based primary health care teams that we recently funded, the investigators that we will fund through these 2 competitions, and a network that is soon to be launched in integrated healthcare delivery that has strong foundations in community-based primary health care. The initiative itself and these 2 funding opportunities focus on supporting research in 2 priority areas, and those center on innovative models for chronic disease prevention and management within the context of community-based primary health care, and improving access to appropriate community-based primary health care for vulnerable populations. I understand some people are having problems hearing me. I'm very sorry about that. I'll try and speak a little bit closer to the microphone. And if there are specific things that you missed, please type them into the comments box, and my colleague Erica can answer them if the sound is really problematic, so I apologize for that. So now diving into the details of the new Investigator Salary Award. If the Institute of Health Services and Policy Research and the Institute of Population and Public Health have put a priority announcement on the new Investigator Salary Award, which is designed to provide outstanding new investigators the opportunity to demonstrate their independence in initiating and conducting health research through the provision of a contribution to their salary. So we have added some funding to support targeted research in the area of community-based primary health care. The maximum amount per new Investigator Salary Award is $60,000 per year for up to 5 years, so a total contribution of $300,000. And our 2 institutes have put a priority announcement of a total of $1.8 million, which would be enough to support approximately up to 6 new Investigator Salary Awards. You're probably wondering what constitutes a new investigator or who qualifies. So here's a list of the eligibility criteria that appear in the funding opportunity. And I highly encourage everyone on the line to take a look in detail at the funding opportunity. It's where all of the information is contained. But I think what we'll do now is take a quick walkthrough of these. And we can talk a little bit more about it in the Q&A session if you have questions. So a new investigator is defined by CIHR as someone who has been an independent researcher for a period of 0 to 60 months. They must have obtained a full-time professional degree or a PhD degree within the last 10 years. They must have a full-time academic appointment, research appointment, or formal commitment to a full-time appointment at an eligible CIHR institution. They may not receive more than a total of 5 years of funding through the new Investigator Salary Award competition, and they must have a commitment from their institution to protect a minimum of 75% of their time for research, and this is really to help catalyze the development of robust programs of research among the new investigators. Additionally, the new investigator must hold peer-reviewed operating funds as a nominated principal applicant or principal applicant as of the earliest start date of their new investigator award. So it's okay if you don't hold one now, but you must hold one by the time that you uptake your award. The review process for the new investigator award is such that the two institutes, so IPPH and IHSPR, will initially conduct a relevance review of the applications. And what we'll be looking for in terms of the relevance review is the extent to which your application has a primary focus on community-based primary health care, and within that, a focus on chronic disease prevention and management in community-based primary health care, or improving access to appropriate community-based primary health care for vulnerable populations. So if you are applying for this priority announcement, it's really important that your application has a primary focus on community-based primary health care. That's what we'll really be looking for in the relevance review. All those applications that are deemed relevant would be eligible for consideration of funding, depending on how they fare in the competition. So once an application has been deemed relevant, it will be reviewed by peer review. And I should say that if your application is not deemed relevant to community-based primary health care, by no means, it doesn't mean that it's pulled out of the competition. It just means that it's not eligible for the targeted funds for community-based primary health care. So a CIHR review committee will evaluate the full applications, and the institutes, so IPPH and IHSPR, will provide suggestions for leaders in Canada and abroad that have expertise in the area of community-based primary health care. Probably everyone on the line is familiar with CIHR's peer review rating scale, but in case you're not, here it is. You can see that in order to be eligible for funding, your application must receive a 3.5 or higher by the review committee. So we can talk about that a little bit more in the Q&A if you have specific questions about that. The review criteria for the new investigator award center on 3 core criteria, and that's the applicant's track record, your research plan, and your environment and support. We won't go into detail about those 3 criteria during this webinar, but I encourage all folks who are interested to take a close look at the peer review manual for new investigator salary award applications, which is available through the link in the slides. And if you have any trouble finding it, don't hesitate to follow up with us afterwards, and we'll share that link with you. So again, so take a good look at the funding opportunity guidelines, the review criteria contained within them, as well as this manual, because there are a lot of helpful tips that that you may find of relevance. This is an important slide. It contains the dates. So the application deadline for the new investigator salary award is December 2nd at 8 p.m. Eastern Time. After applications are received, they go through the relevance and peer review process that I mentioned, and the notice of decision is anticipated for June 30th, 2014, with a funding start date as early as July 1st, 2014. That's it for the new investigator award. So I think what we'll do now is I'll hand it over to my colleague Erica, who will talk about the second funding opportunity, the Applied Public Health Chairs, and then we'll open it up for Q&A on both funding opportunities. So thank you very much, and over to you, Erica.
I guess we'll hear otherwise. So thanks very much for joining us today. So what I'm going to cover are a few slides that speak to the Applied Public Health Chairs program. I know some of you have already asked questions about whether this is similar content to what was covered on a webinar that we held last week. And the answer is yes. However, this program is also related to the Signature Initiative on Community Primary Health Care. So what I'm going to do is very much focus in on this program in relation to that priority. However, when I do get to the slide that speaks to some of the other priorities, I do want you to realize that this is one of several priorities nested within this program. So the second thing I just wanted to highlight before I launch into this is that several of your questions that have been submitted in writing, we do have staff from CIHR's program delivery that Hawa introduced at the beginning of the call, and so hopefully some of those questions can be answered in the meantime because they speak specifically to the new investigator award. So In terms of the Applied Public Health Chair's funding opportunity, what we've done is relaunch this program. Some of you may be aware of the fact that we had a program that was very similar to this back in 2006-07. And based on the results of our evaluation and our analysis of the current landscape, we made a decision with a number of funding partners to relaunch this program. And it really helped, I think, to demonstrate that there was a need for mid-career. One of the questions I do want to answer right at the outset, because we've already received many queries from interested applicants about our definition of mid-career. So I would really encourage you to have a look at the funding opportunity, and if you have any questions, please email those who are listed in the funding opportunity, Lisa Rivet and Catherine Cole, if you're not sure as to whether you're eligible. This program is not meant to directly map onto exact definitions of mid-career that CIHR has used in the past. Very much tailored to the needs of our program, and it is meant to cover a part of the window of the mid-career. But I realize that individual situations are different, and so I did want you to feel very open to emailing staff if you're not sure about that. The other thing that we've done is really take into account some of the recent investments in shares, and also we see this as an institute, along with others participating, as a really good opportunity to tee up our research community to be prepared for the open reforms. And finally, unlike the last call, we are focusing in on very specific priorities because we see this as an opportunity to maximize our impacted areas like community-based primary health care, given large investments being made through signature initiatives of that nature. But there are many other priorities that we've also listed for that reason. So the program objectives, you've likely had a chance to see them in the funding call, but I did want to draw your attention to a couple of them. One is that this award program is very much an opportunity for those applying to articulate a program of population health intervention research, and we do provide a definition of that in the funding call. And I emphasize the word program because we also have had questions from potential applicants as to whether they are responsible for articulating a project. And the answer is that it's really very much an opportunity for you to articulate your program of research over the next 5 years of funding that you're requesting, which would include a set of coherently linked project ideas. This is a salary award and an opportunity for you to use that as a platform to articulate a multi-year program of research. The second thing that this program is trying to really encourage is innovative theories, methods, and approaches. Really, we're very open to many of these types of theories and methods and approaches as they relate to your program of research. The second thing that's implicit in this objective that I wanted to bring to your attention is that this is very much an applied public health chair program, so it's focused on not just research but also knowledge translation, and so that's actually quite critical to bear in mind. And really what we're looking for is opportunities for reciprocal learning between and within countries. And as you will note in the funding opportunity, that means that researchers who are interested in focusing in their application on global health. So for example, if you're doing work in primary health care as it relates to global health, this would totally be eligible under this funding program. So this next slide is just some definitional issues, and so in the context of this program, the definition of community-based primary health care is very much oriented towards the primary prevention aspect and the intervention dimension. And that's very consistent with the definition that Meg outlined at the outset of this webinar, but I did want to bring that to your attention because this is very much embedded in the funding call. So what that means is that we really do want to see programs of research that focus on interventions as opposed to programs of research that inform interventions. And if you have any questions about that, please get in touch with us, but that is an important distinction that needs to be emphasized in your application. So these are just the kinds of questions. They're purely illustrative. You may have others, but in terms of thinking about your program of research, questions that relate to how and why do certain interventions work and what makes them work, so some of the mechanisms, the cost dimension. Again, these are not all included or necessarily need to be a focus in your program, but they're just there as examples of the kinds of intervention questions that you might consider. And then the next slide really speaks to the other program objectives for the Applied Public Health Chairs. So again, what we're looking for is clear indication that you're collaborating with knowledge users. In this call, there is a requirement for you to provide an indication of one collaborator. That doesn't preclude you being involved with other collaborators that are involved in policy and practice settings, but the requirement at a minimum is for you to come in with one formal collaborator. And then the other objective really speaks to the mentoring dimension, and what we're really looking for is a focus on current and the next generation of researchers. And the focus is very much on postdocs and early career researchers that we're asking for. But that doesn't preclude also mentoring for practitioners and policy makers as it relates, again, to your program of research. These are just some of the cross-cutting themes that are embedded, and so for those of you who are thinking about this in relation to community-based primary health care, these are some of the things that you may want to pay attention to as you articulate your program of research. But I would encourage you to have a close look at the funding opportunity and the community-based primary health care description in the funding opportunity for further details in terms of how you can demonstrate relevance of your program to this program. So I've already covered this, and so I think I'll skip over that, but it was really just to re-emphasize the point that this is an opportunity for you to articulate the program of research. And then this slide is really very much intended to give you a sense of what our thinking was in coming up with priority setting principles and why some of the priorities are in there. And so in relation to community-based primary health care, Meg has already covered that territory very well. But it's just, I think, an opportunity for us to really maximize the profile and impact of researchers who are doing work in this area. So for those of you who end up being funded through both the CHAIRS program and the new investigator program, there will be opportunities to link up with other efforts that we're putting in place, including our recent large investment in 12 innovation teams in community-based primary health care to really, I think, help to maximize our impact. So this is just a reminder that community-based primary health care is one of several research priorities that are deemed relevant. And so I'm not going to repeat the focus on community-based primary health care because Meg has already covered that. But I did want to highlight the fact that although this is not a requirement, some of you may be, and this is just a purely illustrative example, be very much interested in community-based primary health care as it relates to Aboriginal people. And so that focus is certainly completely open, but it's not a requirement. What we're doing is just encouraging you to think about some of the synergies between some of these priorities. They're not mutually exclusive. And another example might be that some of you might be interested in having a focus on community-based primary health care as it relates to e-health innovations. Again, it's not a requirement. However, there's nothing preventing you from doing that, and so there are descriptions of all of these priorities in the funding call, and so we would just encourage you to think about that. But those are just examples of how there may be some connections between these priorities. So the eligibility criteria I've already reviewed. So they are that you must be an independent researcher at an eligible institution, and there are very clear guidelines in the funding opportunity. Again, if you're not sure about this, please contact program delivery staff who would be happy to answer your questions. As I mentioned already, you must identify a decision maker as a collaborator, and this is really to emphasize the applied nature of this program. And again, details of what's required are provided in the funding opportunity. I've already covered the definition around mid-career, and So there are some very specific criteria related to that. But in a nutshell, you must have a minimum of 6 years and a maximum of 12 years experience since you received your last qualifying degree. And the last qualifying degree does not, postdoc does not count as a qualifying degree. And so this is calculated from the date you received your degree, not your first academic appointment, and it is calculated as of the full application deadline, which is May 2014 in the context of this funding call. So the eligible dates are May 1st to 2002 to May 31st, 2008. And we do have a series of frequently asked questions that articulate the answer to this. So if you're not sure, we'd be happy to provide that information to you in follow-up. As I mentioned earlier, there are exceptions, and so this could include child rearing, illness, other family-related responsibilities, etc. And so I think every case is quite different, and so I would encourage you to email Lisa Rivet, who is named in the funding opportunity, if you have any questions about your particular situation. In terms of other eligibility criteria, these include a confirmation of a commitment from the institution at the LOI stage, also a commitment for integration as a full-time faculty if you're not presently employed by a university. Again, there are specific conditions that apply, so if you're not sure about your situation, I know we've had questions from folks who are based in research institutions, so I would again encourage you to email us or feel free to ask the question today on the call if it's not clear. And then again, some specifics around non-tenured track positions. And then in terms of the last few slides, what I'd like to do is just briefly review with you the evaluation criteria. These are really critical because this is what the peer review committee will use as a basis for assessing the applications. And so these sort of fall into these categories: research, mentoring, and knowledge translation plan. In the funding opportunity, we have articulated some key considerations. So some of them, which I've already talked about, relate to the coherence of your program of research and how it responds to one or more of the research priorities that I've already referred to. The extent to which your partnerships really relate back to that program of research. Again, partnerships can be with public health organizations or other sectors, depending on your program of research. And they could be at the local, regional, international, national level. That's up to you, but I think what the committee is looking for is an articulation of partnerships, given the applied nature of this program and how it relates back to your program of research, and also a clear knowledge translation component, and some suggestions are articulated in the funding opportunity. And finally, what your plan for mentoring is the current and next generation of researchers, policymakers, and or practitioners. The second really relates to track record, and again, I think this speaks to your ability to demonstrate a track record of significant achievement in the area that you're proposing to develop a program of research in. The third category relates to environment and support, and we've had a number of questions about this. What we're looking for is a clear articulation that the applicant will receive support from their institution for protected time for research, and there are some stipulations in the funding opportunity about that. That the institution will support the scientific development of that applicant to be able to have an independent program of research, that there's some support. And so at the LOI stage, and we've had a number of questions, what we encourage you to do is to articulate to the best of your ability, with the support of your institution, a plan for sustainability after the 5-year period. We really want to see a commitment or an intent to commit from the institution within which you're situated to have a plan after the 5 years, because the salary award program is non-renewable. And then finally, the budget, I think, is fairly straightforward, but again, looking at what the eligible costs are in your budget, and these are articulated in the funding opportunity. And if you have any questions about particular budget-related costs, again, I would encourage you to contact us. So that's the Applied Public Health Chair program in a nutshell. Our contact information is there for the various funding programs, and what I'll do now is just turn things back over to Hawa, and if there are any other questions, please feel free to type them into the chat box. And I see while I was talking, questions have come in, and so if you have any others, please do let us know. The deadline for the Applied Public Health Chairs LOIs is October 30th, and the specifics are in the funding call in terms of what you need to provide at that stage. So thanks so much for your interest in both of these programs, and I will turn things back over to Hawa, and I invite any of your questions at this point in time. Thank you.
All right, thank you so much, Erica and Meg. You've done a great job. And to all of the attendees, thank you so much for your questions. So I'm sure what some of you have noticed is that as people have been asking questions, we've been reposting them, and in some instances, we've been able to provide the answers. That is because, thankfully, over at head office, we have some of our great team members from program delivery who have been able to look at the questions you've all been typing in and have been able to provide a few answers sort of right from the get-go. So a couple of those, maybe I'll just read out some of the ones that we already have answers provided for. So we had a question from Colleen Davison. Are CIHR-funded postdoctoral fellows considered independent researchers in the 0 to 60-month calculation? And the answer to that was no, because you must be a trainee to hold a fellowship award. From Kyla Reed, we had the question, must a nominated principal applicant to the new Investigator Salary Award hold peer-reviewed operating funding from CIHR, or is it all right to hold funding from another tri-agency as per eligibility? And also, what about tri-council funding? So sorry if that was a little long-winded, but the answer to that question is that new investigator applicants can hold operating funding from organizations other than CIHR or the tri-agencies as long as they are competitive, peer-reviewed, and you are the nominated principal applicant or the principal applicant.
Hawa, it's Erica. If I may, I see a question that I don't believe has been answered, which is, it relates to the Applied Public Health Chairs, and it's from Danielle. So you have an understanding of what Applied Public Health is and some clear ideas about community-based primary health care, but you fail to see how the two connect. Well, that's a very good question. There are two answers to that, at least. One is, if your area of research is not primary health care, there are many other priority areas within the context of that funding call that you can certainly consider. What we've decided to do in the context of this funding webinar, I should say, is to focus in on this priority. That being said, the connection that we see is that there are opportunities to implement population health interventions that really are working at the interface between public health and primary care, and together could be woven together in a program of research with that orientation. The definition for community-based primary health care is quite broad, as Meg outlined, and so the focus within the context of the Applied Public Health Chairs program needs to be on interventions, and so that's one example of how the two could connect. But I would encourage you to email me offline if you have further questions about the call and the intersection between that priority and that funding call.
That was great, Erica. Thanks.
Okay, no problem. I'm just trying to see if there are other questions that we haven't responded to. It looks like we've answered most of them. Are there other questions about these two funding opportunities?
I have a question here from Tara Kieran. Will there be another call for a CBPHC New Investigator Award next year? Also, will there be a call for a CBPHC Health Professional Award for researchers with less than 75% research time?
Meg, I can take this and feel free to jump in. I think, as you may know, for those of you who've been following the Signature Initiative on Community-Based Primary Health Care, there were 3 components: the innovation teams, which have just been funded in the last year, a network, which we've had some discussions about actually on a webinar yesterday, and the 3rd component was indeed a Health Professional Award, which was meant to be an adapted version of CIHR's current Clinician Scientist Award. That award program needs to be revamped, but it is very much tied up within the context of a broader CIHR training and career development strategy. And until that strategy is approved and implemented, we were not able to move forward on that. So what we've done in the meantime is therefore offer 2 other salary awards, which are the subject of today's call. So that's the background on why where we are at today. In terms of going forward, we'll have to see what level of interest and what ends up being funded through the new Investigator Award competition this time around, and we'll have to gauge that in relation to whether there will be any further delays in the overall program. And so I guess the bottom line is we don't know yet, but we certainly encourage you to keep in touch with us as we know anything further. But we felt there was a strong need to provide salary support and so capitalize on these 2 opportunities to do so. I don't know if you want to add anything else, Meg, but that I think is as far as we can take it today.
I would agree, Erica. I might just add that if, for example, the decision was made that a priority announcement on community-based primary health care would not be part of the new Investigator Award next year, it by no means precludes people from submitting an application with a community-based primary health care focus. There is an open pool of funds, and regardless of whether there's a priority announcement or not, we would encourage you, if your interest is in community-based primary health care, to submit an application anyways. Would that be fair to say?
Yeah, I think that's a great point. I mean, I think just to be clear for those of you who are not familiar with priority announcements really just give you another chance, if that's the priority of interest, to be considered as long as you demonstrate relevance. But we're piggybacking on an open program, so all research areas are eligible in the context of an open program. So. I see there was a question around decision makers a bit earlier. Was that in relation to I would imagine, the applied public health chairs? So I think the question really is, at what level in the decision making or scale of decision making? That's up to you to actually, I think it's from Heather, the question. You can make that's your determination. I think the key point, though, is that it needs to be aligned with your program of research. But the level of decision making is really up to you. In the call, we say national, local, regional, provincial, territorial, and or international. And so I think that's your call.
There's a question about the eligibility calculation for holding operating funds as part of the new Investigator Award. I'm not sure that that's been answered in the text boxes, and perhaps program delivery can respond to that with certainty. My understanding of it is that it's okay if you don't hold the operating funds as a nominated or principal applicant at your time of application, but that you must show intent to apply, and you must hold them at the time of the funding start date. So perhaps program delivery could confirm that. That would be great. Thank you so much.
Yeah, that's correct.
Okay, wonderful. Thank you.
We have a question here about the rationale for a 12-year max from your last degree. Why not 15 or 20? And while I appreciate that will therefore exclude people, we did really need to hone in, given the availability of funds and the interest from partners, and where our evaluation showed us was the most critical window within the mid-career to focus in on a range. The last time we launched this program, 12 years was also the max. In this round, what we've done is lowered the minimum required from 8 to 6. But we didn't feel that there was a strong enough rationale to change or to increase the range on the upward end. And again, as I said, it's based on our evaluation as well as discussions with partners and a need to really hone in and be strategic. This isn't an open program, and so we had to be very specific. If you have other questions, Karen, please let me know.
Erica and Meg, are you happy for me to read out a few other questions just as they come?
Sure.
Okay, so I have this question from Erica that says, what type of track record are you looking for in the Applied Public Health Chair application?
I would invite you to have a look at the funding opportunity. There are several suggestions of how you can demonstrate your track record and if it aligns. So that to me would be, rather than reading them all out at the moment, I think that is what you really need to be demonstrating, is how you're forging a reputation for excellence and continued contribution to the field. And in that section, there are 3 questions that hopefully give you an indication of how you can demonstrate that track record. I'll just give one example, but again, we can point you to the right section of the funding opportunity. So one example would be your ability to demonstrate the extent to which you have a research and knowledge translation track record in public health, in particular research on population health interventions. So that's just one example of how you can demonstrate your track record, and there are a few others, and they're very much aligned with the program objectives for this funding call. If you have other questions, though, please don't hesitate to email us. And great name, by the way, Erica.
You're not biased at all.
No, absolutely not.
All right, we have this question coming in from Brenna. Can you still include appendices in the CCV for the new Investigator Award, i.e. most significant contributions, other activities, etc.?
Hi, it's Marcella here. No, we've changed that for this year. You cannot include appendices anymore or attachments to the CV, except for one attachment, which is going to be a 2-page attachment that has the information that could not be captured in the CCV, such as for multi-authored publications, the applicant has to identify their role and the percentage of the contribution. Everything else has to go in the CCV.
Okay, thank you very much, Marcella, for clarifying that. This is coming from an earlier question that came from Joe and a related question from Debbie. What are the plans for the new Investigator Award in light of the Open Suite reforms in 2016?
Okay, in terms of the open reforms, we just recommend that you check on the CIHR website in terms of what's being made public regarding the open reforms. We can't answer that question at that time. That's it.
Okay, thank you. Another question that came in from Sergio. Is an industrial researcher that collaborated and co-supervised students with full-time faculty considered an independent researcher for the NPA classification?
I would invite program delivery to comment on that because I think we have clear eligibility.
Sergio, I would actually ask you to email the new investigator inbox so you can give me a little bit more information about your role, and I will be glad to answer you via email, please.
Marcella, we also have a question from Carrie about just clarifying if you hold grant funds, if you hold operating funds as a co-principal applicant, are you eligible to apply for the new Investigator Award? Would you mind commenting on that question?
You are not eligible. You have to hold operating funds as a principal applicant or a nominated principal applicant.
Okay. I see there's a question from Isabel about when the next call for clinical researcher. I'm going to need a little bit more information, but I'm assuming you may mean the Clinician Scientist Award program. I am not sure about that, but if you could email one of us, we can get some information to you. The program as it currently stands, with the current criteria, has continued to be offered, but as I mentioned earlier, there may be changes in the plan for that. So I would hesitate to give you a definitive answer, but please just email one of us and we'll make sure we get an answer to your question. Are there other questions from anyone, or have we covered most of them, Hawa or Emma?
I think we just received another question from Erica.
Okay, there you go.
So her question is, we have some applicants that meet the eligibility criteria for both the Applied Public Health Chair and the new Investigator Award. Can they apply to both?
I think you need to make a decision about one or the other, but program delivery, can someone answer, please?
I can answer the question by email. This is Lisa Rivet. You can send your question via email and I will answer it that way, because we'll have to take a look at the eligibility criteria for the new investigator to compare with the Applied Public Chair, and I can answer it more in depth.
But it sounds like, can they apply to both was the question, as opposed to, but what you're saying is that in Erica's case, she might be more eligible for one versus the other, and so that might just help in making a decision about which one to apply to. Is that right?
This is Marcella here. Well, you cannot hold both for sure because you're both salary support. Right. I would not think you can apply to both because the eligibility criteria would be slightly different, a new investigator versus a mid-career investigator. But yes, if you would, perhaps you can email us and we can go from there. But my first answer would be, I don't think you would be eligible to apply to both.
Okay.
But send us an email, please.
Okay, so Erica, I hope you heard the response there. So the advice is for you to send an email just to make sure, and then you could be advised as to what the best situation is for you. There's a question also from Lori about when did the CCV rule change. Can someone answer that question?
I think you are referring to the attachment. Yes. Is that correct? If you're referring to the attachment, it is current as of this competition, 2013-12, December.
Okay. Are there any other questions that we have missed, or any other questions that folks have?
Maybe in the meantime, while people are still thinking of questions to ask or any details we may have glossed over, if everyone could take the opportunity to participate in a short poll, just so we can get a little bit of feedback from today's session, just to help us improve and to help us get a good sense of how we're doing. So that should have just popped up on the right-hand side of everyone's screen. So if you could just take a few quick seconds there just to complete that as we wait for some of the last questions to just roll in. Thanks, everyone.
Great, thanks. And Howard, do you mind just recapping how the slides will be made available to people? There are a couple questions about contact information, and I believe that's all included in the slides. So what's the best way for people to get a copy of the PowerPoint slides?
Absolutely. So what we can do is we can email everyone who was on this call or on this webinar a list, the PowerPoint slides for this presentation, and then within the next day or two we will have the recording of today's session available, and again we'll be happy to send that out to all of you.
Thanks, Hala.
Yep, absolutely.
So there is a question from Joni about the email to the individual we should speak to about eligibility criteria. Can you please specify which program that you are referring to? Is it the new Investigator Award program, or is it the Applied Public Health Chairs? If you could just let us know, we can then let you know exactly who to contact.
Yeah, I'm just going to try and pull up the presentation again just so we can, okay, for both.
For both? Okay.
Just a moment.
Okay, so we'll do, just give us a sec and we'll do that. Thank you. Okay, so you have the answer to one of them. So for new investigators, it's that email that just showed up, Joni. And for the Applied Public Health Chairs, there's it's Lisa Vivet, and we'll just put her email up in a moment. Thank you. Great, there you go. Just in time.
Well, there don't seem to be any more questions coming in, so I might suggest that we wrap things up, if that sounds okay to everyone. And I'd like to thank everybody for their time in participating in this webinar, and encourage you to get in touch with Erica or myself if you have questions about the priority announcements in terms of the strategic focus. And if you have questions about the eligibility criteria, please connect with our program delivery colleagues who have a great wealth of expertise in what's eligible and what's not eligible. So as Hawa mentioned, the slides will be circulated after this webinar. And please feel free to follow up if you have further questions. So thank you very much, everyone, and we hope you will be submitting applications.
That's great.
Is there anything else you'd like to add?
No, that's great. Just a sincere thanks to all of you for your interest and your questions, and please don't hesitate to get in touch. Thanks very much for participating today.